I'm Dongang Wang, and right now I'm the research fellow in the University of Sydney, working in the Brain Med Center. I'm working in the area of neuroimaging analysis and doing research in the MS research right now. And something about myself is I would say I have both interest in the past and in the future. As in the past, it's like I'm interested in the culture and history, especially in the Asian history. And in the future, is I'm working and hold interest in the AI algorithms and trying to develop new algorithms in the future. After my master's study in the artificial intelligence, I started working in the neuroimaging analysis and trying to develop models to study into the MS lesions and the lesion activities. And from then on, I started to notice that I can use some of my knowledge into some real-world impact research. And also another reason is I grew up in a family of doctors. Both my parents and one of my cousins are doctors, and I think working in the MS research can bridge my knowledge and my family's dedication into the healthcare. One of the most important breaking through, I think, is application of AI models. So previously in the AI algorithms can working on the classification and the segmentation tasks. So we have already applied those into understanding of lesions in the MS and trying to understand the lesion volume and the lesion activities. And this has already been into some medical devices. Speaking of my current research, I'm trying to utilize the very latest artificial intelligence algorithm, which is called the large language model. And this is related to the well-known ChatGPT technique. And this kind of technique can be used to understanding the records of the patients and together with a neuroimaging. And we're trying to utilize this technique to make predictions of the disease progression of the patients. And to use this, and we can apply this into the early intervention of the patients and some personalized treatment. And even we can try to find out whether there are some biomarkers previously not really used by the clinicians and can be used in the clinicians for the diagnosis in the future. Being a researcher, especially doing the algorithm research, the most interesting thing and most challenging thing is to solve the problems. And sometimes these problems can be related to the image quality, can be related to some hyperparameters or pre or post processing of the data. And every time when I can get over it and trying to push the models to get the state-of-art performance, I will feel a lot of sense of accomplishment. And that's the most interesting thing. First, I would like to thank to the whole MS Australia and the donors and fundraisers to offer me this opportunity to conduct my research in this area. And I also want to express my thanks to my supervisor, Michael Bennett, and Chen-Yu Wang, and the whole team of Sydney Neuroimaging Analysis Center. Without them, I cannot make this happen. And I'm really happy to be part of the MS research community and hope we can make some impacts in the future.